Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, Mr. Chairman, for presentation. And شوي راح أحكي لكم بالعربي أول مرة وبعدين ورا ما نحكي بالإنجليزي. Okay? زين. حقيقة أولاً أود أن أشكر الجهة المنظمة للمؤتمر على دعوتها لنا شخصياً لحضور هذا المؤتمر المميز. Cosmic Gynecology, aesthetic gynecology specifically, actually is a new emerging science in almost all the world, specifically in Iraq for the last 3-4 years, from functional and cosmetic point of view. المرأة بنظري، الإنسان بنظري بشكل عام يستحق، والمرأة تستحق كل شيء. خطة التنمية المستدامة Sustainable Development Goals اللي كنا نعرفها it contains 17 goals. The third goal is under the title of health and well-being. Health and well-being. And sexual and reproductive health is an important part of this goal. الحقيقة كان أكو مقولة سمعتها مرة في أحد المؤتمرات العلمية من أحد الأساتذة المصريين، لا أذكر اسمه تحديداً لكن سمعتها وظلت في بالي. Women do not die because of diseases we do not know. They die because societies have not yet recognized that their lives are worth saving. هذه مهمة جداً هذه الفقرة. المرأة كتلة الرقة وكتلة المشاعر المتحركة. هي من تقول، خليني أقرأ لكم المرأة شو تقول بسطرين وباللهجة العراقية شو تقول. أوكي؟ المرأة تقول لزوجها: اخترتك أن تكون أنت وطناً لأحلامي، سيظل عشقك في قلبي وقلبي لغيرك لن ينتمي، يا من ملكت القلب وأصبحت للروح توأمي. المرأة حين تصل إلى العيادة الخاصة نسمع منها هذه الجملة باللهجة العامية، تقول: دكتورة ما أشوف إلا شوفتك. دكتورة ما أشوف إلا شوفتك. من تقول ما أشوف إلا شوفتك I know what she means. She is going to jump here and there with multi-complaint, and gradually she is going to tell you what is actually behind regarding sexual dysfunction. وهذه باللهجة العراقية تقول لك: إيش كثر عندي إعزاز بعيوني ذني، بس زوجي عز الناس حتى عز مني. Okay, let us start with the subject which we have touched regarding sexual dysfunction changes after colopoperineoraphy versus those cases whom we are going to add platelet-rich plasma to the same procedure. This is part of the view. جئتكم من بغداد من العراق. هذه صورة من ساحة التحرير وصورة من عراقنا الجريح. هذه صورة مستشفى العلوية التعليمي للولادة where I work. وهذه صورة لعدد من طلبة postgraduate students in OBG and many senior specialists in obstetrics and gynecology participating in this issue. Now, female sexual dysfunction is actually a recurrent difficulty in sexual response, desire, orgasm, or pain, which will strain the couple's relationship. Its prevalence is a wide range, actually. It ranges between 38 to 63%, because it hides a lot of reasons, as has already been mentioned in many presentations: physiological, medical, psychological, and social components. Unfortunately, only 14% of those women, they do have the courage to discuss the problem with you. Only 14% out of the 63, for the reasons you all know. Women try, in a way or another, thinking of how to build up her family, how to make the problems with her husband much less and less, thinking that if she performs such a procedure, she may have the trend of dragging her husband back to the family and keeping many points of view away from her thinking so as to put her focus just on how to make the sexual function much better. It is her right, yes, but it's not the only issue in response. Many of the cases حالات حقيقة كثيرة بالعراق، لا توجد لدينا إحصائية، بس حالات كثيرة بالعراق وصلت أيضا حد النزاعات المعلنة في المحاكم المدنية، وكثير من الدراسات في كليات الخاصة بوزارة العدل وغيرها تعنى بهذا الموضوع حاليا. The vaginal wall, as you all know, in simple terms, it contains the mucosa, the muscular layer, and the adventitia. And the main work here is in the mucosa. That is the non-keratinized stratified squamous epithelium, which lies on the rich vascular network embedded in connective tissue. The vascular supply of the vagina, you know the vascularity. The arteries are on the midline, anterior and posterior, and the veins, the collateral veins, on the lateral. The innervation, as you all know, it's the parasympathetic by the pudendal nerve. The perineum is our concern here as part of the procedure, the surgical procedure, having the urogenital triangle, the anal triangle, and the perineal body. Vaginal rejuvenation has been touched thoroughly by many of the lectures previously, and it entitles many non-surgical and surgical interventions performed so as to decrease the diameter of the vaginal canal. Traditionally wise, the colopoperineoraphy includes the excision of the vaginal tissue, redundant vaginal tissue, muscular tightening by imbrication of the median levator muscles, tarabut, remodeling of the perineal body. The non-surgical procedures, I'm sure in Egypt here, you have got many, many steps superior to other countries in this issue. The laser technology using the fractional CO2 laser, the erbium YAG laser, the radiofrequency, the vulvovaginal lipofilling, and the injection of hyaluronic acid and or PRP, which is a novel procedure for vulvovaginal rejuvenation. Actually, all these points do need more and more researches to provide a firm evidence on its effectiveness and safety. Platelet-rich plasma, which has just been dealt with the lecture before us. It's the concentrate derived from the whole blood, centrifuged to remove the red blood cells. It contains the growth factors listed here, and it has a greater concentration of growth factors than the whole blood to encourage the brisk of healing response. It is analogous, it is safe, it is non-antigenic, and contains no synthetic agents. Injection of the PRP at the site of the operation is safe and could be effective for the treatment and improving the sexual function. Many evidence from patients suggests that it can be helpful, as well as it can be helpful in the long list of indications here. What we have used in our research work actually is what's so-called the Strasbourg Sexual Self-Rating Scale. This is a simple scale being answered by the patient herself in a privacy. It contains 12 items. It is for self-assessment of the sexual function, and it evaluates 6 domains, including the sexual interest, the sexual activity, the satisfaction in sexual life, sexual pleasure, orgasm, vaginal, clitoric, and sexual relevancy. Among the currently available measures, self-reported questionnaires are the best situated as far as the research is concerned for the sake of research or clinical assessment of the female sexual function. This is the questionnaire, and we have translated the questionnaire into Arabic to be fulfilled by each patient having this problem. The methodology which we used is a comparative interventional study in the setting which I've just shown to you, Alwiya Maternity Teaching Hospital. By the way, Alwiya Maternity Teaching Hospital is one of the biggest hospitals that has 390 maternity beds, and it covers around 25% of all deliveries in Rasafa Governorate of Baghdad. The setting, the data collection was within 7 months, and the study population were actually on 20 women only, because we have restricted the inclusion criteria to get a better result. Those inclusion criteria were a woman with reproductive age group, low parity women, women presenting to you with vaginal relaxation syndrome, women having non-satisfaction, sexual satisfaction by the husband, experienced by the husband, sexual non-satisfaction by both, failed medical treatment for sexual dysfunction, women with a resting pressure, vaginal, intravaginal resting pressure, less than 5 millimeter mercury at rest, or less than 15 millimeter mercury on contraction of the pelvic floor muscles. Women who has refused to be subjected to laser,